Hi, my name is Jan. I'm going to be your nurse today. So what brings you in today?
Well, I was in to see my doctor because my heart was feeling funny.
Okay.
And ever since I've been put on this new medication, I feel like I've just been feeling off, and
Okay.
some weird things have been happening.
Okay, can you tell me about those?
Yeah, so ever since I've been taking the medication, I've thrown up a couple times, and I feel really nauseous. And then I also, one day I went to go watch one of my friends playing baseball, and I just sat in the sun, and I noticed I got really red, and I normally don't get sunburned very easily. And when I went home, I had some pretty good sunburn lines, and it's not normal for me.
Okay. Well, anything else I should know about?
No, I don't think so.
Okay, well, I'm going to go talk to your provider real quick, see what kind of medications you're on, and see if we can get this sorted out.
Okay.
Hi, Lexi. So I talked with your doctor, and it looks like you've been taking amiodarone, is that correct?
Yeah, that sounds right.
That sounds right. So you're taking that for your arrhythmia. So some of the symptoms you kind of described me sound like common adverse effects of amiodarone. So nausea and vomiting, you're going to see that. We can maybe look, if it gets really worse, we can maybe look into some antiemetics and stuff like that. For the sunburn, again, photosensitivity, that's another common adverse effect with amiodarone. Basically what I can tell you is make sure you get a higher SPF, maybe like above 100 if you can. Do you know what you were using that day?
15, 30 maybe.
Yeah, we're going to want to up that a little bit, maybe just limit time in the sun, just since you're on this. And then two, we're going to want to set up a thyroid and liver test function, just because sometimes with this medication it can make your liver and your kidneys the levels that get a little different, and we want to just make sure those are working correct. So we'll get you up front and we'll get you set up for a schedule with that.
Okay.
Okay.
Good morning. My name is Morgan. I will be your nurse today. So what brings you in today?
Hi, I'm coming in today because I feel lightheaded and dizzy. Like I get this tightness in my chest, and sometimes it just feels like my heart skips a beat.
Okay, I'm just gonna go ahead and take a peek in your record here. Okay, I see that the doctor has already ordered an EKG. So an EKG is used to see if there's any abnormalities in your heart rhythm. So I'll just go grab that machine real quick.
Okay.
Hi Ryan, welcome back. So the provider has reviewed your EKG, and it looks like you do have a ventricular dysrhythmia. The provider would like to start you on a medication known as amiodarone. This is a medication that you're going to have to avoid things such as grapefruit juice, and also check your pulse before taking this medication. You will withhold this if your pulse is below 60, and then you would not take it. This medication slows your sinus rate and prolongs the action potential and refractory period of your heart rhythm. So before we finish our visit today, we need to know, do you have a history of bradycardia, any heart blocks, or are you pregnant or planning on becoming pregnant, as this medication can cause fetal harm, since the dysrhythmia can cross into the breast milk and the placenta as well.
Okay. I haven't been told that I have bradycardia, nor have I had a heart block, and no, I'm not currently pregnant or plan on becoming pregnant.
Perfect. So we're just going to have you come back in a month for a recheck and watch for any side effects as well while taking this amiodarone. Everything we talked about is in this handout I have for you. So just call if you have any questions or any concerns.
Okay, sounds good. I see that this medication has a half-life of 13 to 107 days, is absorbed through the GI tract, and is metabolized by the liver. I'll go out to the front desk and get that scheduled. Thank you.